Hello, everyone. Welcome to the From Compliance to Competency webinar series presented by the Regional Centers for Workforce Transformation. My name is Jen Parsons, and I work at the New York Alliance as the Assistant Director of Workforce Advancement. I also work as the Region 3 co-lead for the Capital District for the Regional Centers. I think it's also important to share for this competency that I have taught SCIP-R, Strategies for Crisis Intervention Prevention Revised, as a certified instructor for over 10 years. I've also gone through the PROMOTE course as well. PROMOTE stands for Positive Relationships Offer More Opportunities to Everyone. This is relevant for our topic today. Here with me today is Region 2 South's champion, Dylan Brown.
Hello, my name is Dylan Brown, and I work at our Kirkmer as a program manager. Over the last 3 years or so, I have assisted Regional Centers for Workforce Transformation in Region 2 with a variety of trainings and events. In the next 20 minutes, you will hear a scenario and view visuals that will help you to not only remember the skills associated with Competency R, but you will also see examples of how and when to utilize your skills to best demonstrate your competency.
Today's competency is R, which is supporting crisis prevention, intervention, and resolution. We will discuss topics from SCIP-R as well as PROMOTE. This competency is important because as a DSP, preventing potential crises is a major key when you're obtaining safety. For a DSP, it's about staying proactive with the people that you support by getting to know them through and through. In addition, it's about supporting people to be in control of their lives and choices. If we can support people to address their needs and wants early, before things bubble up, we can usually avoid the escalation and use of a personal or physical intervention technique. There are two main skills associated with Competency R. These skills are demonstrates skill in applying the principles and practices of the OPWDD Promote curriculum and or SCIP-R. Number two, demonstrates respect for the safety of all others. Please note, in New York State, we are currently using both crisis prevention and intervention curricula for the workforce, PROMOTE and SCIP-R. Which curriculum you are trained and certified in will depend on where you work in the field. So for this reason, you will see and hear references to both in today's webinar. By understanding these two skills, ultimately the DSP enables the person being supported to obtain and sustain high levels of their own self-control, which is the goal here. Achieving this can avoid potential harm to self and others, create a safe environment, improve relationships, increase one's level of independence, as well as opportunities for community involvement, both personally and professionally. We will go over how to utilize these skills more specifically. But first, let's start off with a scenario where we will apply our general knowledge of these skills. Keep the skills listed on this slide in mind as you listen to the scenario.
Meet Jeremiah. Jeremiah is a man who receives supports a few times a week in his own apartment. He has a job coach to support him while he's at work. Jeremiah's job coach, Rob, and he have worked together in the supportive employment world for over 2 years. They have a positive working relationship and seem to enjoy their time together. Jeremiah is usually very successful at work, and he's even on the brink of receiving his first promotion since he began work 2 years ago. Recently, Rob has noticed every morning for the past 3 days when Jeremiah arrives to work, he's been displaying signs of discontent and emotional distress. For Jeremiah, this often looks like fast pacing, clenching hands and teeth, and sometimes he forms a physical rash on his forehead. Worse, sometimes he will demonstrate verbal aggression towards peers or his DSP, shouting profanities, and more dangerous, yesterday during his peak of escalation, he displayed physical aggression towards the same people specifically, pulling hair and attempting to bite. This environment can potentially get dangerous fast if Rob fails to attempt crisis prevention strategies with Jeremiah. Rob is not sure why this is happening now and said, frankly, it seems as though this sudden spike in challenging behaviors has come out of nowhere. The reason why is not obvious at this point. He thinks to himself and says to a clinical staff member, what could be causing Jeremiah's sudden spike in challenging and dangerous behaviors? We haven't seen this from him in over a year. For some reason, this week, every day since Monday, he has pulled hair twice, attempted to bite a fellow coworker, and yelled profanities at staff and peers for over an hour. As a DSP, how would you respond to this? If you were Rob, what should you be considering, and how would you support Jeremiah in this challenging scenario?
There are several things you could do to address this scenario and demonstrate your competency in R. Let's remember the two main skill sets associated with Competency R. Demonstrates skill in applying the principles and practices of the Promote curriculum and/or Skip R. 2. Demonstrates respect for the safety of all others. As we go over these skills, I want you to think about how you would apply each approach to the scenario with Jeremiah and Rob. What are some possible steps Rob could do that are both ethical and in line with the skills associated with core competency R? The first thing we learn in Promote and Skip R is to question Jeremiah's medical, physical, or internal state. That's always first. If something appears to be physically or medically wrong, we should support that first. Are there any medical or physical signs and symptoms that you observe? You should question, what are the possible internal antecedents or triggers which is causing this sudden spike in challenging and dangerous behaviors? Based on knowing Jeremiah and having previous experiences with him, you make an informed guess. And we do this with the help of the whole team, including your frontline supervisor, perhaps Jeremiah's family, if they're involved, yourself, the DSP, nursing, clinical, a care coordinator, and perhaps others. Remember, DSPs, your input is vital. DSPs spend a large amount of time with the people that we support, so including DSPs in these discussions is key. So medical. Is he sick, injured, or just not feeling physically well? If you think yes, you need to follow your protocols for medical and emergency procedures, including administering CPR and first aid as needed. Likely this will address the issue right away and stop the escalation if the causes for this challenging behavior are indeed related to medical, physical, or internal reasons. More examples of this could be, is he on a new medication that's causing side effects and/or discomfort? Is he lactose intolerant and he has some milk or cheese? Is he perhaps suffering from a toothache, or is he catching a cold? Again, we call this medical, internal, or physical triggers or causes for the challenging behaviors.
After ruling out medical, internal, or physical causes, the second thing to question is what external or environmental factors are present? What about Jeremiah's external environment could be causing this sudden spike in challenging or dangerous behaviors? Is there anything you observe that is out of the ordinary and perhaps causing him distress? For example, sensory discomfort. Is there a rainstorm that is too loud or causing him anxiety? Or perhaps the lighting in the room is too bright? Or are there too many people in his workspace preventing him from concentrating, hence causing the escalation and decreased self-control? Is there someone or something in his space causing fear and anxiety? What does fear look like for Jeremiah versus anger? Did someone change his job duties? He perhaps feels confused and or overwhelmed on how to do his job. These are the types of questions Promote and Skip R teaches us to ask, and above all, how to best avoid potential crises, while ensuring a safe and supported environment for all. Doing this can sometimes make you feel like a detective. If you feel like a detective when supporting people and their challenging behaviors, you are probably doing a great job. So take note on internal and external factors, then communicate and document. Next, you want to assist the team in understanding the function or causes to the challenging behaviors and help to formulate strategies to address needs and wants as they appear. When able, it's best to teach the people we support to be in tune with their needs and wants while promoting independent type strategies or positive behavioral supports to where the person can meet their own needs and wants, ideally before it bubbles up as a challenging or dangerous behavior. Not everyone can do this without DSP support, and that's okay too. We know behaviors are more often a form of communication. If the person supported is in full control of their lives and choices and getting his or her needs and wants met early and independently, and if we can get great at observation and communication, specifically listening, 9 times out of 10, we can avoid the crisis and use of a personal or physical intervention technique, usually. Now, let's go back to the scenario where Jeremiah is displaying a sudden spike in challenging and dangerous behaviors, seemingly out of nowhere. Remember, our main goal here is to be a detective. Together with the team, we gather information and take a guess as to what we think the function or causes to the behaviors are. From here, we can formulate the best way to respond and support Jeremiah using positive behavioral supports for the prevention of future crises for Jeremiah at work or elsewhere. Side note, the clinical team should also update new or existing behavior support plans and the whole team briefed regarding all updates and modifications. DSPs, this is a great time to get all your questions out and give your input regarding the person you are supporting. Remember, your voice matters.
More ways in which you can respond is to communicate with the other people who support Jeremiah at his house. Maybe his other DSPs know more about what is going on this week and can provide valuable input from their unique perspective. Are they seeing the same observations as you are at work? So have a chat in a respectful, professional, and HIPAA-friendly way. Side note, Core Competency Goal Area 3, being a professional, also teaches us how to do this. Another way in which you can respond is to ask Jeremiah if he is okay with you riding the bus to work with him tomorrow morning instead of meeting him at work. This to observe him during his transportation time. Perhaps you observe it's nothing more than a new person on his bus route who is sitting in his favorite seat, and he just doesn't have the ability to communicate this. Perhaps the bus driver listens to music that reminds him of a bad time in his life, and it triggers discontent for the rest of the day. Who knows? But the point here is to keep questioning and observing and collecting the details so we can improve our supports for Jeremiah in the present moment as well as the future. In addition to all of that, ask yourself, have I offered supports for Jeremiah that connects him to others? Think about his relationships with family, friends, other DSPs, or other people who play an important role in his life. Would this help? Other questions. Have you offered other opportunities for relaxation and stress reduction? Have you discussed the individual's vulnerabilities and strengths? Have you discussed potential irritants, for example, that rainstorm? What usually works to de-escalate Jeremiah in these times? Can he recall any of the things that has worked in the past? And what does all of this tell you? Just a bit on the skip our gradient scale. That is the level of support we offer from a least to most approach. In other words, we don't want to overstep. We want to use the least restrictive approach possible and in the most independent manner possible for that person. Less is better in this case because using less intervention means Jeremiah is able to do more for himself.
However, if you do end up needing to use an approved personal or physical intervention technique to prevent harm to the person's self or others, do so only in the way you were trained and certified in. Anything else used can be viewed as abuse and cause serious injury, including death. Do you feel you can effectively intervene when a person is a danger to themselves or others? If you don't feel safe effectively intervening, please communicate this to your frontline supervisor so you can receive additional training from a certified promote or skip R trainer.
Sometimes, despite our greatest efforts to stay proactive, we still need to use one or two personal or physical intervention techniques on occasion. This does not make you bad or incompetent. It may mean you missed something in the proactive or active phase in skip R. Or if you're talking about promote, you may have missed something in the green or the yellow zone. But again, sometimes it still happens regardless. So if you did your best to avoid it, then don't feel bad. Stay professional, you're doing great. However, if you do need to use a personal or physical intervention technique, remember, please do not use more physical support than you need, and always choose something that's least restrictive.
After the person regains their self-control and the crisis subsides, it's vital that the person involved reconnects with the person who they physically restrained so they know and feel whatever just occurred is done and over. No one is holding any grudges, relationships can rebuild, and perhaps teachable moments can surface for both parties. This is called resolution, reconnecting or resolving the crisis. Don't forget to document, check for injuries, and follow up with the nurse. Give a quick body check in a private and safe area, and give a look for any bruises or other injuries. And continue to question, how can we best avoid this next time if this situation presents itself again? If you have more questions about the safe use of personal or physical intervention techniques, please consult with your clinical team and certified promote or skip art instructor in your organization. Remember, only those certified in skip R and or promote are permitted to use personal or physical intervention techniques.
Those are just a few examples of ways we can demonstrate competency in R. Remember, our main goal for core competency R is to avoid the crisis and use of a personal and physical intervention technique. We do this by staying proactive. Sometimes to keep everyone safe, DSPs must intervene physically. Equally as important is the DSP's ability to reconnect, resolve, and move on. Remember, don't hold grudges, stay a professional, and don't take things personally. People escalate sometimes, despite our greatest efforts to avoid this. Please be sensitive to how the person feels post-crisis, especially if a staff member needed to use a personal or physical intervention technique. It can be very traumatic for everyone involved. Try and preserve the person's dignity, respect, and privacy. Knowing and having the ability to implement the individual's behavior support plan can also help the mastery of core competency R. Doing these things shows everyone's competency in R, supporting crisis prevention, intervention, and resolution.
Please view the activity attached to DSP Core Competency R, download, have fun, and let us know how you like it. There are more webinars like this on each of the 23 core competencies, as well as many other resources on the Regional Centers for Workforce Transformation website, www.workforcetransformation.org. Thank you for tuning in and have a wonderful day.